Welcome to BlitzBiz. I'm Dr. Applesmith. Let's begin with today's video. On December 4th, 2024 at 6:44 in the morning, a man walked up behind Brian Thompson on a Manhattan street and shot him twice. Thompson was the CEO of UnitedHealthCare, the largest health insurance company in America. He died on the sidewalk. Within hours, the shooter's face was everywhere. The manhunt was national news, but something strange happened. When Americans saw that face, they didn't feel what they were supposed to feel. A poll taken days after the shooting found that the majority of Americans blamed insurance company profits and coverage denials alongside the killer. Not just the killer, alongside. People were putting out t-shirts, making memes, defending a murderer. And in that reaction, in that uncomfortable, disturbing, impossible to ignore reaction, was a story that nobody in the business world wanted to tell. This is that story. The business of denying your health care and the $400 billion empire that was built doing it. Most Americans don't fully understand what UnitedHealth Group is. They know UnitedHealthcare, the insurance card in their wallet, the phone number they call when a claim gets denied. But UnitedHealth Group, the parent company, is something far bigger. It is the largest health insurance company in America. It covers more than 50 million Americans. In 2024, it posted revenue of $400 billion. That's not a typo. $400 billion. More than Nike, Starbucks, McDonald's, and Netflix combined. It is the 7th largest company in the entire world by revenue. And here's the part that matters for this story. Health insurance companies make money in one specific way. You pay them premiums every month, they pay out as little of that money as possible in actual health care. The gap between what comes in and what goes out, that's the profit. So the business incentive, the fundamental structural incentive of every health insurance company in America is to collect as much as possible and pay out as little as possible. That means denying claims. And UnitedHealthcare had become, by almost every measure, the most aggressive denier in the industry. Here's how the denial machine actually worked. UnitedHealthcare used an AI algorithm called NH-Predict to review Medicare Advantage claims. A 2023 class action lawsuit alleged that this algorithm had a 90% error rate when its denials were appealed. Read that again. 90% of the time a patient fought back, the denial was overturned, which means 90% of those denials were wrong. But here's the thing about wrongful denials that the insurance industry understood perfectly. Most people don't appeal. The appeals process is complicated, time-consuming, and designed to be exhausting. Elderly patients on Medicare often don't have the energy, the knowledge, or the time to fight. So the algorithm denied. Most people gave up. The company kept the money. UnitedHealth's investors loved it. In fact, and this detail is almost impossible to believe, when UnitedHealth announced in 2025 that it was going to reduce its denial rates in response to public pressure after the Thompson killing, its own investors sued the company. The shareholders sued UnitedHealth for approving more healthcare, because approving more healthcare meant less profit. The company's stock dropped 22% in a single day, wiping out $119 billion in market value, partly because it was paying more medical claims. Think about what that means. Wall Street punished a health insurance company for providing more health care. That is the business model. So who was Brian Thompson? He was 50 years old. He had a wife and 2 sons. By all accounts from people who knew him, he was decent, hardworking, and genuinely believed in what he was doing. He had been with UnitedHealth for 20 years. He became CEO of UnitedHealthcare in 2021. He wasn't the architect of the denial machine. He inherited it, he ran it, he optimized it. His compensation in 2023 was $10.2 million. The morning he was killed, he was walking to an investor conference where UnitedHealth was going to present its financial results to Wall Street. He was killed by someone who left shell casings with the words deny, defend, and depose scratched into them. Those 3 words are from a book called Delay, Deny, Defend, a critique of the insurance industry's tactics for avoiding paying claims. Whoever killed Brian Thompson wanted everyone to understand exactly why. Luigi Mangione was 26 years old when he shot Brian Thompson. He grew up wealthy in Baltimore. His family owned nursing homes and country clubs. He graduated from the University of Pennsylvania with 2 degrees, a bachelor's and a master's in computer science. He graduated valedictorian. He worked in tech in San Francisco. By every external measure, he had everything. But in the months before the shooting, something changed. He had suffered a serious back injury. He had become increasingly isolated. People who knew him said he disappeared, stopped responding to messages, stopped showing up. He had written extensively about his views on the American healthcare system and corporate America. When he was arrested in a McDonald's in Pennsylvania 5 days after the shooting, he had a fake ID, a 3D printed ghost gun, and a handwritten manifesto. The manifesto described the American health insurance industry as parasitic, his word, and said that what he did was necessary. He faces life in prison. His state murder trial begins June 8th, 2026, and every American with a health insurance card will be watching. The killing of Brian Thompson didn't just change the conversation about healthcare in America, it physically changed UnitedHealth's business. Within weeks, the company announced it was reducing prior authorization requirements, the process that led to so many denials. The CEO who replaced Thompson, Andrew Whitty, spent months trying to rebuild public trust. It didn't work. In May 2025, Whitty himself resigned, citing personal reasons. The company pulled its entire financial outlook for 2025, the first time it had done that in years. Its stock, which had been one of the best performers in the S&P 500 for 2 decades, lost nearly a third of its value. The Department of Justice launched an investigation into its Medicare billing practices. And then, on May 18th, 2026, just last week, a New York judge ruled that key evidence from Mangione's backpack would be suppressed. The gun and the notebook can still be used, but the phone, the passport, the wallet, his lawyers called it a major victory. The trial starts June 8th. The whole country will be watching. Here's the question that this entire story forces you to ask. How did America end up with a healthcare system where the largest insurer in the country made $400 billion denying claims, and when its CEO was murdered on a sidewalk, millions of people's first reaction was not sympathy, but recognition? The answer is complicated and uncomfortable. The United States spends more on healthcare per person than any other country on earth, by a massive margin. Americans spend $13,000 per person per year on healthcare. The UK spends $5,000. Germany spends $7,000. And Americans have worse outcomes on almost every measure: life expectancy, infant mortality, chronic disease management. Where does the difference go? Some of it goes to hospitals, some to pharmaceutical companies, some to administrative costs, and some of it, a significant sum, goes to the gap between what insurance companies collect and what they actually pay out. UnitedHealth Group's profit margin in its insurance division is about 5 to 6%. On $400 billion in revenue, that's $20 to $24 billion in profit per year. From the gap between premiums collected and claims paid, that is the business model that Brian Thompson ran. That is the business model that Luigi Mangione says he killed him for. Whether you think what Mangione did was justified, monstrous, or something in between, the system he was reacting to is real, and it will still be there when the trial ends. So what does any of this mean for the average American? A few things worth knowing. First, if you have UnitedHealthcare insurance and a claim has been denied, you have the right to appeal. The appeals process is designed to be difficult. Do it anyway. As we showed earlier, 90% of appeals on AI denied claims were overturned. Second, the pressure from this case has already changed the industry. Prior authorization requirements at multiple major insurers have been reduced. That is a direct result of what happened on that Manhattan sidewalk in December 2024. Third, this trial is going to put America's healthcare system on trial alongside Luigi Mangione. Every witness, every piece of evidence, every detail about claim denials and corporate profits will be front page news for 4 to 6 weeks starting June 8th. Watch it. Understand it. Because the healthcare system is the single biggest financial relationship most Americans have outside of their mortgage. And most Americans have almost no idea how it actually works. Brian Thompson is dead. Luigi Mangione goes on trial June 8th. UnitedHealth Group is fighting to survive the biggest reputational crisis in its history. And 50 million Americans are still paying premiums to a system that by design is incentivized to deny their claims. This story isn't over. It's just getting started. Subscribe to BlitzBiz for more real stories about the companies and systems that shape your life. New video every week.